This video explains about epilepsy seizures and following things about epilepsy, difference between epilepsy and other seizures, goals of epilepsy treatment, risk factors of epilepsy, reasons causes of epilepsy, types of epilepsy, anti-epileptic drugs, first-line treatment for different types of epilepsy, anti-epileptic drugs discontinuation, epilepsy drugs in pregnancy, epilepsy drugs in breastfeeding. Difference between epilepsy and other seizures. Epilepsy, any seizures without cause or history of unprovoked seizures. For treatment, anti-epileptic drugs are used. Other seizures, any seizure with cause like hypoglycemia, hyponatremia, drug withdrawal or traumatic brain, no use of anti-epileptic drugs, but in case of stroke, use anti-epileptic drugs. Status epilepticus are seizures equal to or more than 5 minutes. Tonic-clonic seizures lasts for more than 5 minutes. Life-threatening and emergency treatment needed. Status epilepticus breaks down into 2 types of side effects. Convulsive side effects or non-convulsive side effects. Non-convulsive side effects may present as seizures with coma. Possible triggers of status epileptics are epilepsy syndrome, cerebral damage, brain tumor, electrolyte abnormalities, drug or alcohol overdose or withdrawal, encephalitis. Treatments of status epileptics: diazepam IV, clonazepam IV, Phenytoin IM, Phenobarbitol IM, IV. Goals of epilepsy treatment: prevention of seizures, don't treat seizure at the time of occurrence, appropriate management of seizures, prevention of adverse effects, increase quality of life. Risk factors of epilepsy: premature birth, small gestational weight, perinatal injury, history of alcohol withdrawal, history of febrile seizures, non-adherence to anti-epileptic drugs, acute or chronic structural brain injury. Reasons or causes of epilepsy. These are 4 reasons or causes in the epileptic patients. Sodium channel is hyperactive, lower inhibitory mediators, low GABA, higher excitatory mediators, high glutamate aspartate, high influx of calcium through calcium channel. Types of epilepsy: 1. Partial, focal, simple partial, complex partial. 2. Generalized seizures, grand mal, tonic-clonic, petit mal seizures, myoclonic seizures, febrile seizures, status epilepticus. Partial or focal seizures. In partial seizures, some parts of body get affected by seizures. Partial seizures are of 2 types: simple partial, no loss of consciousness; complex partial, loss of consciousness. Generalized seizures. In generalized seizures, full body gets affected or generalized with loss of consciousness. Generalized seizures are of 5 types. Tonic means, if convulsions are symmetric. Clonic means, if convulsions are asymmetric. Grand mal tonic, clonic, seizures. A grand mal seizure causes a loss of consciousness and violent muscle contractions. It's the type of seizure most people picture when they think about seizures. A grand mal seizure, also known as a generalized tonic-clonic seizure, it is caused by abnormal electrical activity throughout the brain. Petit mal seizures or absence seizures. Absence seizures involve sudden lapse in consciousness and staring blankly into space. The episodes last less than 15 seconds. Rapid and short loss of consciousness 2-3 minutes seizures. Least potent seizures. Myoclonic seizures. Myo means muscles. Clonic means asymmetric convulsions. Myoclonic seizures are brief shock-like jerks of a muscle or group of muscles. During a myoclonic seizure, the person is usually awake and able to think clearly. Febrile seizures. Febrile seizures are seizures or convulsions that occur in young children and are triggered by fever. Happens in children. Febrile means with fever. Status epilepticus are seizures equal to or more than 5 minutes. Tonic-clonic seizures lasts for more than 5 minutes. Life-threatening and emergency treatment needed. Status epilepticus breaks down into 2 types of side effects. Convulsive side effects or non-convulsive side effects. Non-convulsive side effects may present as seizures with coma. Anti-epileptic drugs, AEDs, barbiturates, Phenobarbitol, Primidone, 2 benzodiazepines, clobazam, clonazepam, diazepam, lorazepam. Anti-epileptic drugs, AEDs, 3 carboxylic acid derivatives, valproic acid, D-valproix, 4 GABA derivatives, gabapentin, Vigabatrin, 5 hydantoin derivative phenytoin. Anti-epileptic drugs, AEDs, 6 imanostilbene derivative, carbamazepines, oxcarbazepine, 7 succinimide derivatives, ethusuximide. Anti-epileptic drugs, AEDs, 8 others, lacosamide, lamotrigine, levetiracetam, therampinol, rufinamide, topiramate. First-line treatment for different types of epilepsy, focal or partial seizures, carbamazepine, lamotrigine, levetiracetam, phenytoin, absence seizures, ethusuximide. First-line treatment for different types of epilepsy, myoclonic and atonic seizures, valproic acid, grand Mal seizures, carbamazepine, lamotrigine, levetiracetam, phenytoin, valproic acid. Anti-epileptic drugs discontinuation. Following are the terms to discontinue anti-epileptic drugs. Onset after 2 years old and before 35 years old. No seizures for at least 2 years. Normal neurologic examination. Complete control within 1 year of onset. Normal ECG. Phenytoin. Mechanism of action. Sodium channel blocker. Decrease the propagation of impulses from hyperactive neurons. Results in the decrease electrical excitability of neurons. Adverse effects of phenytoin, gum hyperplasia, megaloblastic anemia, teratogenicity and nystagmus. Carbamazepine, mechanism of action, sodium channel blocker, decrease the propagation of impulses from hyperactive neurons, results in the decrease electrical excitability of neurons. Adverse effects of carbamazepine, nystagmus, rash, blood dyscrasias, hyponatremia, hepatotoxicity. Valproic acid, mechanism of action, increase GABA inhibitory levels in CNS, decrease aspartate excitatory levels in CNS, results in control of hyperactive impulses. Adverse effects of valproic acid, hepatotoxicity and thrombocytopenia. Phenobarbitol, mechanism of action, increase GABA inhibitory levels in CNS, decrease glutamate excitatory levels in CNS, results in control of hyperactive impulses. Adverse effects of phenobarbitol, respiratory depression, nystagmus, sedation, ataxia. Ethusuximide, mechanism of action, calcium channel blocker, blocks T-type Ca channels, decrease the abnormal electrical activity in brain. Adverse effects of ethusuximide, stomach irritation, nausea and vomiting, sedation, inability to concentrate. Lamotrigine, mechanism of action, only inhibit excitatory neurotransmitters, inhibit release of glutamate and aspartate, prolongs inactivation of sodium and calcium ions. Adverse effects of lamotrigine, blurred vision, uncontrollable movements of the eyes, difficulty thinking or concentrating, difficulty speaking, headache, drowsiness. Gabapentin, mechanism of action, more production of GABA inhibitory neurotransmitters, decreased degradation of GABA, decrease the abnormal electrical activity in brain. Adverse effects of gabapentin, drowsiness, tiredness or weakness, dizziness, headache, uncontrollable shaking of a part of your body, double or blurred vision. Vigabatrin, mechanism of actions, irreversible inhibitor of GABA, normally, degrades GABA, inhibit vesicular GABA transporter, decrease the abnormal electrical activity in brain. Adverse effects of Vigabatrin, problems walking or feeling uncoordinated, feeling dizzy, shaking, tremors, joint pain, memory problems and not thinking clearly, eye problems, blurry vision. Topiramate, mechanism of action, potentiates inhibitory effect of GABA, blocks repetitive EPSP firing by inhibiting sodium and calcium channels, changes phosphorylation of ion channels by kinases, decrease the abnormal electrical activity in brain. Adverse effects of topiramate: blurred vision, burning, prickling, or tingling sensations, clumsiness or unsteadiness, continuous, uncontrolled back and forth or rolling eye movements, drowsiness, eye redness or pain. Levetiracetam, mechanism of action. Exact mechanism of action is unclear. Adverse effects of levetiracetam: headaches, feeling sleepy, blocked nose, itchy throat. Epilepsy drugs in pregnancy. If patient is childbearing age or want to become pregnant, levetiracetam, lamotrigine or oxycarb may be good to go. If patient is pregnant, never switch the medicine. During pregnancy avoid valproic acid, carbamazepine, phenytoin, topiramate, levetiracetam, Phenobarbitol, Phenytoin. Epileptic drugs used during breastfeeding. Safe drugs during breastfeeding: carbamazepine, phenytoin, valproic acid, lamotrigine. Caution during breastfeeding: Phenobarbitol, Phenytoin, Ethusuximide. Learn terminologies with MJM.